name is Linda Hawley Isbell. I'm the Associate Vice President of Provider Relations and Engagement and Provider Support Services here at Trillium, and I am excited to welcome you to our meeting today. So we have a full agenda for you today. We're going to do a welcome and an overview of Trillium's tailored plan. We're going to talk about some provider survey results. We're going to talk about appointment wait time standards. There'll be some information about provider direct upgrades. We'll talk about some network opportunities that you may be interested in. There will also be some information about Eastpointe and Sandhills legacy system wind down. We'll talk about the EPSDT. There'll be information about essential information for physical health providers. And then we'll have a time where we will provide some resources and have a live question and answer session. So we want you to engage with us throughout the meeting. We do have subject matter experts on the line, and they will be able to answer questions during the meeting. We ask that you use the Q&A feature to submit your answers, and they may be answered during the meeting. If it's something we need to take back and get another SME to respond to, we will do that and send those out on a frequently asked document. Please see the accessibility features for closed caption. And as a reminder, the use of artificial intelligence features, including but not limited to programs and/or apps to assist with transcription and/or recording during any Trillium WebEx meeting is not permitted. This meeting includes the following features: recording and transcript highlights. And we will have a live Q&A at the end. And this is and it shows you how you can go to the Q&A box to enter your questions throughout the meeting. They will be either answered in that chat or we'll discuss them at the end of the meeting. And you can type your question in as you see here in the example. Okay, I'm going to turn it over to Chauncey Dameron.
Thank you, Linda. I'm going to do an overview of the Trillium and the tailored plan. Trillium Health Resources, the tailored plan and a managed care organization that manages serious mental health, substance abuse, traumatic brain injury, and intellectual developmental disability services in North Carolina. For individuals receiving Medicaid through the tailored plan, we cover physical health and pharmacy services as well. We also help uninsured individuals through state-funded services. We cover over 46 counties with a land mass of 28,977 square miles. Percentage of the land mass in North Carolina is 59.61%, with a total population of 3,152,058, which is probably making up to 30% of the population of North Carolina. The members and recipients that Trillium serve, we have 78,378 tailored plan members, 163,000 Medicaid direct members, and this is approximate numbers. State-funded recipients, we have 287,000 uninsured individuals. Innovation waiver members, we have approximately 4,853 slots and an estimated 5,304 persons on the innovations waiver waiting list, which is 67% receiving state or B3 services. And members receiving TCM through Trillium or an AMH Plus or CMA is 14,412. People served, we have 61% mental illness, 16% IDD, and 23% SUD. Medicaid state, mental health is 44,716. State is 9,900, and then SUD is 12,657, and state is 8,667. IDD 14,006, and IDD state is 1,059. So we have the total of the 65,159 for Medicaid and 17,690 for state. Next slide. Our physical health network providers make up 54,105 providers, and then behavioral health is 14,103. Our vision providers are 452, pharmacy and medical supplies 2,788, and this covers all 100 counties. This is a list of some of the tailored plan partnerships that we have with Trillium. Next slide. Some of those partners are Carolina Complete Health, which is our standard plan partner responsible for our physical health network, including the primary care, specialty care, durable medical equipment, vision, long-term services and supports, non-emergency medical transportation, and non-emergency ambulance transportation. Centene Vision Services is our vision partner, which is formally involved through our agreement with CCH, responsible for our optometry network. Perform RX is our pharmacy benefits manager partner, which is responsible for our pharmacy network. Motive Care is our NEMT partner, and through our agreement with CCH, responsible for our NEMT network. And of course, we have our oversight entity, North Carolina Department of Health and Human Services, which is responsible for managing the delivery of health and human related services for all of North Carolinians. Now I'm going to turn it over back to you, Linda.
Thank you, Chauncey. So last year we did a provider survey, and these were the top 7 topics that you as our provider network indicated you wanted us to provide technical assistance and education on. And we did that. And we have just completed a survey that we had out until the end of last week. Our May provider survey that went into the first week of June. We wanted to allow 30 days for that. If you go to the next slide, Jamie. And so we just received the May provider surveys updates yesterday. And so in the network management department, we're going to be analyzing that data. We want to thank you for submitting your survey results. There was a lot of great information in there. We're just going to analyze that and sort that out. And then starting in July, we'll start presenting on those topics. We'll also share with you what those top topics were that you identified as our provider network. And we'll talk with you about how we're going to be providing information and technical assistance on those topics throughout the next several months. So thank you again. We encourage you anytime we have these provider surveys, it's so we can get information from you on what topics you would like for us to provide the technical assistance and education on. So it's very helpful. Thank you again, and we'll start presenting on those topics next month. And now I'll turn it over to Joanna.
Good morning. Thank you. My name is Joanna, and I'm one of the network managers, and I'll be covering the appointment wait time standards. So Trillium conducted a survey audit back in December with a focus of behavioral wait time standards. Trillium's audit resulted in some out of compliance findings. So we just like to take a moment today just to provide an overall review of each of the visit types covered and the standards that are published in our behavioral health and IDD provider manual. These can also be found in the link provided here in that provider manual as well. Our contract requires us to meet these service availability and wait time standards as published in our behavioral health tailored plan manual, along with in compliance with the compliance code of federal regulations with the department requirements. So just for review, the appointment wait time standards are mobile crisis management services, and the standard is required we meet that within 2 hours. We have facility-based crisis management services, emergency services available immediately, availability 24 hours a day, 365 days a year. We have our emergency services for mental health. That's also immediate, available 24 hours a day, 365 days a year. Emergency services for SUDs, That's immediately available 24 hours, 365 days a year. Urgent care services for mental health, that's going to be within 24 hours. Urgent care services for SUDs within 24 hours. Routine services for mental health is within 14 calendar days. And then our routine services for SUD services is within 48 hours. All right. Next slide. I will turn it over to Ms. Tanya Simmons for Provider Direct upgrades.
Good morning. Thank you. I'm Tanya, and I'm from the Trillium IT department. Next slide. So we're here today to talk about some maintenance that we have planned for Provider Direct in our SFTP environment. We're going to do maintenance updates to our production servers in our SFTP environment over the July 4th holiday weekend. So I want everyone to be aware that beginning Thursday, July 3rd at 5 p.m. close of business through Monday, July 7th at 8 a.m., the Trillium Business System platform, which is our Provider Direct portal, and our SFTP integrations are going to be unavailable. This is not going to impact any other portals that may be used, but we want everyone to be aware and plan accordingly during this time for authorizations and claim submissions, because you will not be able to access, submit, or interact with Provider Direct or our SFTP servers. Your claims must be submitted prior to 5 p.m. on Wednesday, July 2nd in order to be included in that July 9th check write. Any claims that we receive after 5 p.m. on Wednesday, July 2nd, when the system is down, those will be processed once everything is restored, and they'll be included in that next July 16th check write. For TARs, anything that gets submitted on Monday, July 7th, that has a start date during that time frame that we are down from July 3rd through July 7th, they will be honored and accepted for review. Next slide. And we want to just remind everyone as far as to ensure your continued access with our SFTP environment, that IP addressing is subject to change with these upgrades. So if your organization is currently connecting to our Trillium SFTP environment, make sure that you are using the URL that's listed here and that you're not doing an allow listing based on IP address. So again, that's really important to make sure you're not connecting based on an IP address, but instead allow the listing based on the URL. Next slide. And I'm going to turn it over to Richard. Thank you.
Thank you, Tanya. How's it going, everybody? My name is Richard Uranga. I'm with the Network Development Department. I'm a Network Development Coordinator, and I am the veteran point of contact for Trillium. I'm just going to take a second to kind of highlight the current service gaps that we have across our region. So these are going to be areas where we're actively looking to build capacity and have providers that are interested in providing these services to collaborate with. Starting from the top left, we have adult partial hospitalization. That is a licensed service, and we have a need for adult partial hospitalization in Carteret, Craven, Dare, Hyde, and Pamlico counties. The next service is child and adolescent partial hospitalization. This is also a licensed service, and it is needed in Carteret, Craven, Dare, Hyde, Onslow, and Pamlico counties. Opioid treatment program, again, a licensed service. This is needed in Anson, Beaufort, Bertie, Dare, Lee, and Richmond counties. Moving to the top right now, we have psychosocial rehabilitation, again, a licensed service with a need in Dare, New Hanover, and Currituck counties. And then lastly, substance abuse comprehensive outpatient treatment, a licensed service with a need in Carteret County. Next slide, please. So with these needs, if you have a license, that would be ideal. because there'd be less to do. However, if you don't have a license and are interested in providing these services, either way, whether you're licensed or not licensed, the way you would apply would be to email network services support at trilliumnc.org. So if anybody is interested in providing any of these services, please send that email out so we can get your information and start working towards the onboarding process as far as making sure that your organization is qualified. Next slide, please. And that is all I have. I appreciate you all, and I will pass to Sarah Hodge.
Thanks, Richard. Good morning, everyone. My name is Sarah Hodges, and I'm a project analyst at the Trillium IT department, and I'm here today to talk about legacy claim systems wind down. Next slide, please. So as many of you are aware, Trillium consolidated with Eastpointe and Sandhills Center in January of 2024. Now that we've passed out through the 365-day claims timely filing window, and we're about 18 months into consolidation, we've noticed that our claims volume has dropped. So we're going to begin decommissioning some of our legacy claim systems. As a result of this decommissioning, provider access to Eastpointe Alpha, Sandhills Alpha, and the Eastpointe MetaTrack and iTransact provider portals will end at midnight, Monday, June 30th. Also, access to the Eastpointe and Sandhills FTP sites will end on this date, Monday, June 30th, as integrations with claims clearinghouses and vendor partners for legacy claims will be decommissioned as well. So this includes, but is not limited to, partners such as Change Healthcare and HHA Exchange. We encourage providers to submit any retro Medicaid claims for dates of service January 31st, 2024 and before for Eastpointe and Sandhills now. And we also encourage you to export any documents such as RAs from the provider portals. As of July 1st, providers must reach out to claim support to submit claims for legacy Eastpointe and Sandhills, and a claims specialist will be happy to walk you through the process. Again, submissions through claims clearinghouses will not be accepted after this date. No changes will be made to current processes for Trillium claims. That includes provider direct, Trillium integrations, and Trillium EVV billing through HHA Exchange. Next slide, please. And with that, I'm going to pass things off to our next presenter, Sheila Lee.
Good morning. Thank you. I'm Dr. Sheila Lee from the UM department, and I'm going to briefly highlight information regarding early and periodic screening, diagnosis, and treatment, commonly known as EPSDT. Okay, the next slide. Okay, so EPSDT is a critical Medicaid benefit that ensures children and adolescents receive the care that they need early and often. It mandates coverage of medically necessary services for those under the age of 21, even if the state plan doesn't list them. A big focus here is on prevention. So health check visits, also known as well child visits, include a full developmental health screening with the purpose of preventing, detecting, and treating health conditions. Health check visits, as well as well child visits, do not require prior authorizations. And the next slide. EPSDT doesn't stop at screening. It extends to diagnosis and treatment. If a screening identifies a medical issue, EPSDT ensures the child gets the necessary services, even those that are not listed on the Medicaid plan, as long as they are medically necessary. So non-covered services may be requested. Prior authorization is required for diagnosis and treatment services, as well as non-covered services. Services must be medical in nature, allowed under the Section 1905A of the Social Security Act. Services must be safe, effective, and not experimental in nature. and they must also be an accepted standard of care through evidence-based practices. Okay, the next one. When requesting services under the EPSDT for a child or youth under the age of 21, a treatment authorization request, or TAR, must be submitted. The service being requested must be medically necessary, meaning it is needed to correct, improve, or maintain a health condition. One key point to remember here is that under EPSDT, services can go beyond the normal Medicaid limits. This includes going over the usual number of visits, frequency of care, or even location where the service is being delivered. So it can exceed the benefit plan. Also, EPSDT allows coverage of services that aren't typically included in the North Carolina Medicaid state plan, as long as the service falls under the categories allowed by the Social Security Act and meets EPSDT criteria. The primary goal is that the requested service supports health improvement or helps maintain a child's functioning. So the justification must clearly connect the service to the child's physical or behavioral health needs. Okay, the next slide. When requesting prior approval for services under EPSDT, it is essential that the request is fully documented to show medical necessity. This means providing clear evidence that the service is needed to correct or improve a health condition. So the clinical documentation must fully support medical necessity. The documentation should include clinical notes or recent assessments or any screening results that support the request, also like provider notes, CCAs, addendums, PCPs, care plans, psych evals, CFT meeting notes, school records, or other documents to be reviewed. This helps the reviewer understand the child's current condition and why the requested service is appropriate. So for services not typically covered under the North Carolina Medicaid state plan, or if services are not listed in our benefit plan, a specific form must be completed and submitted along with the clinical documentation by the provider. So the last slide shows a copy of this form. The next slide. Okay, it is a 3-page document. It is located on Trillium's website under the For Providers section. You'll find all the EPSDT information in this section, as well as this form. It's called Prior Approval Non-Covered Service Request Form for beneficiaries under the age of 21. So you will need to complete this form along with the documentation so we can review the service request. Any questions, you can email us at um@trilliumnc.org. Thank you. And I'll pass it on to Gaines and Jess.
Thank you. My name is Gaines Carey, and I am the Education and Training Coordinator for Carolina Complete Health. Next slide. So today I just wanted to do a couple of quick updates. Just wanted to remind DME providers that DME is considered a physical health benefit, and providers should submit claims and authorizations using these methods, which are the Trillium Physical Health portal. So if you're submitting claims, we do use our clearinghouse availability with that payer ID 68069. You can also mail your claims to the address listed here. In regards to prior authorizations, you may also use our portal or phone or fax that information in. Next slide, please. Just a little bit more guidance on DME. A face-to-face encounter or through telehealth is required for referring physicians and the member. It must be directly related to the reason the member requires the medical equipment, as well as the physician must include clinical findings from the visit and needs to incorporate it writtenly into the electronic document or the member's medical record. And there must be correlation between the DME and the member's medical disability. We ask that you refer to the DME equipment fee, the DME fee schedule for the rates associated with equipments and supplies. Additionally, I've listed the clinical coverage policies, and they can be used as a reference for regarding benefit limitations and additional billing. Next slide, please. And just listed here is the top claim denial trends for May. The #1 claim denial was this primary EOB authorization required for EPSDT considerations. As of right now, we've linked the known issues tracker on here, but it is a known issue. And so the guidance for this would be to just wait for the configuration to take place. Provider does not need to do anything. Once the correction is made, we will take it on our end and reprocess the claim. The next claim denial that is, I think it's the #2 trend. This is the non-eligible, non-reimbursable service per plan or regulatory guidelines. So in this, we recommend that the provider, it's not covered or reimbursable. So we always say, make sure you check the Medicaid fee schedule, and that link is listed here. Additionally, you're going to want to review the clinical coverage policy and make sure that the procedure is billable by your provider type. The last 3 trends that we're seeing are taxonomy related. This is just a quick reminder that NC Tracks is your source of truth, and that you're going to want to always update information, whether you've had a provider change or added or removed from your practice, that you're going to want to update this on NC Tracks. And that information is listed here if you need any questions or have any questions regarding that. Next slide, please. Just some important reminders. Next slide. Around the third-party billers, there's been some questions around this. If you do use a third-party biller, they are able to have access into our Trillium Physical Health portal. That biller needs to reach out to the portal account manager. From there, that account manager will invite them to register for the portal. When that invitation is received, they'll need to have their information as well as their TIN number, and they'll need to fill that out. From that point, once that step is completed, the account manager will need to verify access for that biller. Next slide. And lastly, just some trainings available. We had a PCS provider training earlier this year. There's a link here to the slides, the recording, as well as some Q&As. We also do host a Trillium Physical Health Provider Orientation that's offered monthly. And I've linked the provider onboarding checklist. This is just a guide for providers that are new to tailored plans. And if they have any questions surrounding that, this is what they need to do to get set up. And then lastly, we do have our home health office hours, which are tomorrow at 11 a.m. We are partnering with Trillium on this call. We host those every month, Thursday, or I believe it's the second Thursday of every month at 11 a.m. And if you click that link, the dates will be there for if you want to attend one. But this is just a reminder that the EVV hard launch is in October. So if you are a home health provider, please attend these sessions. There are going to be a lot of information around that. Next slide, please. And then these are just some additional resources. We've got the provider manual, the billing manual, as well as some links to some tailored plan provider resources, and then just information around the DME stuff that I just reviewed. Next slide, please. And at this point, I'm going to pass it over to Kimberly Wagner. Thank you.
I'm going to fill in for Kim. This is Chauncey. So we're just going to make sure we go over some resources. On our Trillium page under the For Providers heading, this is where to the bottom where you see the first arrow, you see the provider form question and answer. So all the questions that are asked in the forum today will be posted on our resources page. And then we also will have all the previous forum Q&As posted there as well as the recording and the presentation. And then above, you see where provider information is. You can select provider forum right there to get to the provider forum page. Next slide. And we want to thank you for the participation here of our provider forum. And we'll go to our question and answer section. We'll go to the first question that I see in the Q&A. And we'll see if we have any subject matter experts up here. The first one says, does Trillium require physician referral for ASD evals? And do we have a subject matter expert on the call to be able to answer that? And if not, we will just take that back and answer it in our Q&A. Is anyone here from UM?
Yes, I'm here from UM, but we'll have to take that one back to the team. That sounds like that's the IDD.
Perfect. Okay. Thank you. And then our next question was, who is responsible for adding the 1915I Community Transition Support Service to a provider's contract?
I can speak to this one, Chauncey. If somebody else on the call also has any additional information, it is welcome. But ultimately, to add any services to a contract, it would be the responsibility of the provider to request that addition. And that would be using that same network service support email that I had alluded to when discussing the network gaps. Once that email is received, there's an entire internal team here at Trillium in various different departments that review and then ultimately get that added to the contract. But ultimately, it's the responsibility of the provider to initiate that process.
Thanks, Richard. Next question, how do providers access the Carolina authorization dates for the 1915I services? We have
This is Linda. I think we might have to take that one back. We are going to have a presentation coming up this summer on 1915I. So that will be a really good time to ask any other questions about that, but we will take this one back.
Okay. And I don't see any more in the Q&A. Is there anyone that would like to come off of mute? If we can do that.
Yeah, just raise your hand if you'd like to do a live question, and Jamie can send you the invite to do that.
And while we're doing that, we have one more question. What will be the next step after the service has been requested from network support and the response was to get the care manager to add the service? I think that goes off of your response, Richard.
Yeah, I wouldn't really be able to answer that without knowing more specifics. That seems more like a specific question rather than general. So I think the best way to do that would be let me throw my email in the chat. What would be helpful to research that would be your specific ticket number, and then I'd be able to review that ticket number and help answer that. So I'll put my email in the chat, and if you just shoot me an email, and then we can figure this out for you.
Great. You can put it right there under their answer, Richard, for that question, that specific question, and then we keep it together. Do we have anybody's hands up? I can't see the participants.
I don't see anybody hands raised.
Okay.
Linda, just excuse me, just as a reminder, as Chauncey showed you, a copy of this PowerPoint will be posted on our website under Provider Forum. So I know there were a lot of really good links shared today and some really good information about the appointment wait times, as well as other information shared. So please make sure you go in and look at that and share that within your organization. I know we wrapped up early today. We had a short agenda for this June meeting, but we'll wait about one more minute and see if there's any more hands. If you'll just raise your hand if you'd like to come off mute and ask a question. As a reminder, we will be sharing the outcome of that provider survey that many of our providers participated in with you next month, and we'll start providing education on those topics. We'll be doing another survey again in the fall to continue to make sure that we're up to date on the information that's important to you. Jamie, do you see any hands?
I still don't see any hands.
Okay. Well, we'll go ahead and wrap up for today. Thank you so much for attending the June Trillium Provider Forum meeting. We appreciate each of you and all of the work that you do to support our members. And we'll see you next month at our July provider meeting. Thanks and have a great day.